Good afternoon, guys. It's Marvel here again. How have you enjoyed your first week of online teaching? I hope it hasn't been so bad, and I'm hoping that by now you have gotten used to it. And how have you enjoyed first week as well? Lockdown. I hope the kids aren't doing your head in yet, or they are. Oh, I hope you're coping, anyways. Today's session is quite short. It's going to cover criteria 2.2, which is involving family members in patient slash client care. So we're going to go through it quite quickly. You're going to have two activities, and I hope that you answer those. And don't forget to sign the register as soon as you have come in as well. So if you haven't signed, just pause the video, go in and sign, and come back. Okay, so the aim for today is, quite simply put, how do we involve family members in the care that we deliver as healthcare professionals? So we're going to understand or reiterate, because we touched on this last week, patient-centered care. Look at some practical ways of involving. That's poor spelling. Apologise about that. Practical ways of involving family members in the care of patient slash client. Understand healthcare adaptations and assisting patient and family members in care adaptations. Okay, so we touched on patient-centered care last week, and there's a link there. So I'm going to upload the PowerPoint slides as well onto your Padlet, so you can click onto that link and you find out a little bit more about patient-centered care. Okay. We said last week that patient-centered care is focusing on the needs of the individual. It's about empowering and encouraging your patients, giving them all the information they need to then make informed decisions. So as a partnership, patient-centered care is a partnership between the healthcare professional and a patient. So as healthcare professionals, because you are the experts, what tends to happen in healthcare settings is that it's kind of expert-led. It's a top-down approach saying, I'm the professional, I know what I'm saying, do as I say. We're finding more and more that approach isn't working. But what is working is when healthcare professionals partner with their patients, meet them where they are, recognize what barriers exist within their lives that is making good health difficult, and seeing how we can remove those barriers, work in partnership with them, encourage and empower them to make informed decisions that will lead towards better health. Now, this is the same for families. Patient-centered care basically means doing all these things and then involving the family members in that. Okay. So why do we involve family members? Simple. Family members are a support system. We said last week that at the point you're going to your GP, going to the hospital, going to A&E to receive healthcare, or going to a home, you are already vulnerable, and it's so much more easier when you have somebody there. So it's your support system. Research shows that when you have someone there, you are more optimistic. You're more optimistic that you will recover. People that have a good support system tend to have better recovery outcome as well. And it's about accessibility and availability. Yeah, so you might have appointments that you can't access, but if you have someone to take you there, and it's easier. Availability could also mean someone to listen into what's been said. I remember so many times I'm going and having reports with my doctor, because in the last 2 years I think I might have said it in class, struggled with something called intracranial hypertension. And so many times the doctors say so much stuff, and I'm there with my husband, and by the time we've gone into the car, we start comparing notes, and he says something, I was like, oh, I didn't hear when he or she said that. So we get more information, so that patient-centered care, about having the information to make that informed choice. You get more of that when there's someone there hearing what you might have missed, either because you've zoned out or you're stressed. So it's so important to have that support system. That's why it's so important that you as a healthcare professional are not just talking to the patient, but you're also talking to husband, daughter, sister, whatever family member the patient has there. Okay. And sometimes our family members know us better than we know ourselves. So asking, there have been times when the doctor has asked me something and I've turned to my husband and gone, yeah, well, what's the answer to that? Because he knows me sometimes better than I know myself. So as a healthcare professional, then involving a husband or a spouse, you probably get much more information off them than you would the patient, whether because they don't know or because they're not willing to say. Yeah. Right. Healthcare adaptations. Okay, so we're going to look next into healthcare adaptations. So your first activity, I know it says in group there, scratch that. Individually, I want you to make a list of what sort of adaptations would be made for a person who has been diagnosed. So in groups, you would have done all of them, but I want you to pick one or two. So let's say someone has been diagnosed with diabetes. What kind of healthcare adaptations are they going to need in their life? Someone with leukemia, terminal cancer, dementia, or double amputation. What kind of, obviously, when you receive that kind of diagnosis, your life has changed forever. So what kind of healthcare adaptations is a patient with double amputation going to need? What kind of healthcare adaptations is a patient with diabetes going to need? Okay. Right, healthcare adaptations. This is usually it's a human right. Health is a human right, and because healthcare is free in the UK through the NHS, we are entitled to healthcare adaptations if we are diagnosed with a life-changing sickness, disease. So healthcare adaptations are done in collaboration, done by occupational therapists in collaboration with the council. So it is about, so it's aimed at helping people to be independent, to be able to live in their home for as long as they can. It's about encouraging independence, encouraging normal movement, and also to prevent further deterioration. Because, for instance, if someone is a double amputee, their life has changed, and they might not be able to manage to live in their homes the way that they would have if they didn't have that amputation. So it's the occupational therapist's role to come into the house and see how they can make practical amendments so that that patient can be able to move about independently. So it's about that patient independence that we're talking about last week, and also to prevent further deterioration. If you were ill and you can't live the way that you used to, if those adaptations aren't made, you're only going to get worse. And as we said, health is a human right. So it is your right within the UK, if you have a life-changing diagnosis, for the occupational therapist to come to your home and to make those necessary adaptations for your independence. And who better to involve when you've had a life-altering diagnosis than the family members and the people that live with you? Yeah. So the family members will be able to help to encourage that independence for the patients, but to help them in the recovery process as well. So it is so important as healthcare professionals that you're not only empowering the patient, but you're empowering the family member in order for the family member to help the patients, because you're not going to be there all the time, but the family members will be. Yeah. Okay, so how do we involve family members? Like I said, you do it by educating them. Show them how to do it. Do you remember that first video that we watched? And the doctor, or I don't know if she was a nurse, was talking to the husband, teaching him about the dosage. Yeah. The patient might forget. The patient might not be physically able to do it. So educating the family members on what to do is a very practical and good way to involve family members. Signposting them. You can't be everything. You might be trained as a nurse, but you could possibly not trained in every other thing. So signposting them, that's why, again, it's important for healthcare professionals to know this stuff. So as a teacher, for instance, I'm trained to teach, but I might not be trained with safeguarding and finance, but I know who to turn to. So I would then refer my students to say, go to this for advice on this. So that is an important way to involve family members, signpost them to where they can get information to help with the care process for their family member. Training where possible, training the family member. So this is quite closely linked as well to education. Train them, train them on how to use stair lifts. Yeah, train them on what to do if there's a fall. Train them on what meals are right, how to what to do if someone's been diagnosed with a child has been diagnosed with asthma, knowing what to do if they're ever in a crisis. Yeah, so practical stuff like that. And I'm doing home visits where necessary, or at least giving them the right number to call, signposting. Okay. Have I missed any? Please put it in the comment section if you can think of any other practical ways to involve family members. Okay. So, quick recap. We've talked about patient-centered care and how that patient-centered care can also be applied to family members. We've looked at healthcare adaptation, how health, physical, mental, social health is a human right. So if you are diagnosed with a life-altering diagnosis, disease, ailment, and you need some adaptations to be made, you are entitled to that, and that is done by the council and the occupational therapist. And we've looked at some practical ways that you can involve family members. Like I said, it's quite a short one, but your second activity is to go back to look on the slides for the previous lesson, go back to Fiona's case study, and I want you to answer the question, how would you involve Fiona's family members at the beginning stage of her diagnosis and during the care that she received from the care centre? Okay, so how would you involve her husband, her children, her two sons? How would you have involved them at the beginning when she got her diagnosis? So imagine that you are the doctor, the nurse that gave that diagnosis. How would you involve? And then fast forward to her time in the care home. How would you involve her family members in the delivery of care at that time? Okay, and put your answers in the activity box below. Okay, if you've got any questions, please fire them at me. And I will try my best to answer to the best of my ability, or I'll nominate Tara or Jade to answer it. Okay, enjoy the rest of your day. Bye bye.